Welcome to NYC Health and Hospital Kings County YouTube podcast. In today's episode, we're going to discuss the Center for Hope and the services available. I am Maria Abdallah, the HIV Medical Director at Kings County Hospital. I'm here with Ms. Dayomati Singh, the Associate Executive Director of Medicine that has more than 18 years' experience in HIV management and practice. Hi, Ms. Singh.
Hi, Dr. Abdallah. Thank you for this warm introduction. I appreciate this podcast. I'm excited to share some services that we offer with Center for Hope.
Thank you, Ms. Singh, again. So again, with all your experience that you have, coming here to Kings County will be a really great opportunity to have you here to manage our Center for Hope. So let's start with a little bit of history. What is, and definitions, what is the Center for Hope?
So it's funny that you asked. Center for Hope actually has a long meaning, and I bet a lot of people don't exactly know what hope means. But Center for Hope was developed and established to provide care for our HIV patients during the epidemic. The word hope was derived as HIV outpatient evaluation. The hope actually means hope for our patient in a positive setting when there were uncertain times for our patients.
Thank you. This is really important because it gives me the impression that the Center for Hope was implemented a long time ago, early on in the epidemic. Can you give us more details, like when exactly this started?
Kings County was actually the pioneer for treating patients with HIV. We actually established in 1985 as the AIDS team and then slowly transitioned into Center for Hope to practice primary care for our HIV patients and their affected partners.
So the next question is, let's dig into more details on what services are available at the Center for Hope.
Center for Hope is a one-stop shop that provides a slew of services to our patients and their families. We offer primary care to our patients. We offer mental health. We offer social work, nutrition, GYN, pharmacy. We offer counseling and testing, nutrition, social work, and collaborative care to our patients.
So knowing all this now, what do we tell at this point HIV patients who were recently diagnosed and they really feel like they're going to die and HIV is a death sentence? What do we tell them at this point? Is that true, or what are the options they have?
I can see 30 years ago when patients felt that there was no hope at all. Back then, there was no hope because patients were just dying. Now, HIV is considered a chronic disease where patients are living longer and healthier, just like anybody else with a chronic disease, such as diabetes and hypertension. So it is not a death sentence. There are many opportunities for a patient to get treatment and stay healthy.
Yes, great. That's true. It's really considered a chronic disease now and part of primary care. So another question, does the Center for Hope offer counseling?
Center for Hope actually offers HIV counseling and testing. We're one of the oldest establishments that still continue to offer HIV counseling and testing because there's still stigma associated with HIV, not only within the Center for Hope, but across the campus. Specifically in the ED, patients who are tested positive are linked to care by our HIV counselors. In addition to HIV counseling and testing, we offer mental health counseling to our patients that are infected and affected to their families. We offer collaborative care social work, we offer case management, we offer nutrition counseling, and we offer any type of mental health counseling to our patient that has any type of comorbidities.
So now, Ms. Singh, how has the treatment and testing technology advanced over the years? What have some of the major advancements we have right now?
So treatment and testing has advanced over the last 30 plus years. In regards to testing, we have come a very, very long way. I remember back in the days, patients were waiting at least 2 weeks to get an HIV test results. In those 2 weeks, times have elapsed, mental health, patients were depressed, families were wondering, patients were thrown out of their houses just waiting to know what the unknown might be. Today, we have HIV tests that can be in minutes, such as 20 to 30 minutes, especially in high-risk areas where a mom might be in the labor and delivery waiting to give birth and that provider may not know what their status is. So we can have that stat and within 20 minutes know someone HIV test result.
Yeah, thank you. That's very important, especially in immediate ART, what we call immediate starting treatment for HIV. The fastest we get the HIV test, especially if it's positive, the fastest we can start treatment and prevent transmission and end the epidemic, as the New York State is actually have a goal to end the epidemic. And also I want to mention the advancement in treatment right now. From one pill once a day, we moved now to injectable treatment where the patient can get an injection once every 2 months and forget about taking pills at home that remind them of their status every day. So now we've been focusing on HIV testing and treatment. Do we offer other sexually transmitted infection testing or just HIV?
Center for Hope has a very unique STD practice within its department where we test patients for gonorrhea, chlamydia, trichomonas, syphilis, and other sorts of STDs. We are one of the establishments within Brooklyn that do this on a regular basis where we can diagnose patients right away and providers can treat them immediately.
Now I'm going to ask you a specific question to your role. We always focus on clinical staff and clinicians seeing patients and treating patients and have a face-to-face contact with the patients. But when it comes to administrator, as an administrator and a grant manager, how do you feel like your work actually helped the community and how the administrator is actually a big part of healthcare now? And I want you to talk more about your role as an administrator.
Dr. Abdallah, that's a very important question. I'm glad that you asked. As an administrator, we work with our providers to complement each other in each other's role and each other's discipline. We come as expertise in business and finance, in strategic planning, in operations, in budgeting, in various tasks that we were assigned to ensure that our healthcare system is running efficiently. In regards to our community, we are innovators and creators as well with our providers that work alongside to create programs and initiatives to ensure these services are optimized to the highest capacity. Specifically, when it comes to grant management, we have about 5 to 6 grants currently in our HIV program. Without these grants, we would not be able to start any initiative or optimize our revenue and services that we currently have. This allows us to access resources that we might not be able to afford.
Thank you so much, Ms. Singh, for this. This was really very helpful. And this is a great example that the team is actually what bring all the care and the best resources for the patient from clinical and non-clinical staff. And the Center for Hope, I think, is a big example for how clinical and non-clinical staff work together for the best of the patients and the community. And I want to emphasize the great experience you have with Grant and to bring more resources to our hospital and to our ambulatory care. Thank you so much for this, and thank you for tuning in.